So today's patient is 77 years old, very pleasant elderly lady who has arthritis of one knee only. So when we clinically examine, she doesn't have a flexion deformity, but varus is not correctable. So one thing is there, if the varus is not correctable, you cannot do a unicondylar knee replacement because you need a correctable varus. Now we are planning a robotic knee replacement for her. And as I mentioned that I will give her a functional alignment, number one. Number two, the exposure of the knee is smaller because robot doesn't want us to dislocate the knee like in other conventional and computer navigated cases. You don't need to put big retractors on the medial or the lateral side. Hence, if you're doing a lesser soft tissue release, lesser inflammatory markers will be released and patients have a better pain control. Apart from that, this is a jigless system, so you don't need any jigs. So I have got a CT planning. I will expose my knee joint. I will check the ligaments, laxity in full extension and 90 degree of flexion. According to that ligament laxity, I will be adjusting my implant with minimal releases or no release at all. Once my implant is adjusted, I've got some restrictions that I can put so much of valgus in the femur or varus in the tibia. Once I have balanced the equal flexion and extension gap, for example, 19 medial and lateral gap in extension, 19 medial and lateral gap in flexion, I know my 9 size poly is going to go. Then I lock it and then the computer cuts. The other advantage is the control is in my hand. So the